Concor drug, a medication that reduces blood pressure and provides additional benefits. Today we will evaluate this extremely popular drug. Welcome to my channel. Today we analyze medicinal preparations in the continuing section. Finally, we arrived at Concor. You have numerous questions regarding it, a multitude of comments. Therefore, today we will be addressing this specific medication, probably one of the most commonly prescribed and popular medications in the field of cardiology. Today we will try to figure out why it is needed, when it is still advisable to appoint it, and when it is not worth appointing it at all. So, the medication Concor. Concor is classified as one of the so-called beta blockers. This is one of the groups of drugs, so-called drugs of choice. If you know, there are only 5 main groups of them. So beta blockers are very often used to treat high blood pressure. Not only high pressure, we will now talk in more detail about the cases in which it is still prescribed. However, it is important to be aware that Concor is a trade name. In other words, this medication is sold in pharmacies under the name Concor. Its active substance is Bisoprolol, which is an international non-proprietary name, so-called Bisoprolol. Beneath this mask, there might exist a range of medications, like bile, for instance, Nipertin, and so forth. That is, there is a huge selection of bisoprolols, but I think that Concor is probably one of the most popular and most prescribed drugs. At what times is it necessary to take beta blockers directly without any delay? When is it more suitable to begin taking beta blockers, and in this instance taking Concor medication? He possesses 3 primary and most importantly crucial indications. In contrast to other medications, the range of actions of this drug is slightly wider and more comprehensive. It is prescribed not only for arterial hypertension, not only for high blood pressure, but also for the treatment of chronic heart failure and ischemic heart disease, mainly for stable angina pectoris. This is a substantial collection of diseases and chronic heart failure, as well as blood sugar and arterial hypertension, which are significant medical conditions. Therefore, a large circle of patients can be covered by this drug, and that's why he's so popular today. If you were still prescribed this medication and you genuinely need it, you have one of these 3 diseases, and you actually started taking Concor, it is typically taken once a day. It is advisable to commence taking Concor with a minimum dosage if you have not taken it before. This is a recommended approach for new users. Usually I give 1.25 ml dose, i.e. 1.25 ml, that is 1.25 ml. Take milligrams once daily. Time is not of utmost importance, but usually it is scheduled for the first half of the day, preferably in the morning. If the drug is well tolerated, it begins to have an effect within the initial 3 to 4 hours, and after a week, 10 days, 2 weeks, we can already start to increase the dosage with good tolerability of the drug. So, in no situation should you begin with large doses immediately. I will clarify why. Because Concor has such an impact. In addition to lowering blood pressure, it also decreases the rate at which the heart beats. So, it decreases the pulse rate. Consequently, if you have any abnormalities or issues with your pulse rate, then naturally you need to exercise more caution in selecting this particular category of medications for your condition. If you have taken a tablet of Bisoprolol, as I repeat, it starts to take effect in 3 to 4 hours. Its effect lasts for 24 hours. After that, the action weakens and completely disappears. If you have been taking the drug Bisoprolol for a long time, it is important to know that you should not stop it abruptly under any circumstances, as it can cause withdrawal syndrome and exacerbation of angina attacks, for example, if you have it. And the pulse may increase sharply, therefore this medication cannot be abruptly cancelled. To decrease the dose gradually is desirable, just as to increase the dose is desirable. For example, you have been taking Bisoprolol 5 mg for several years and have decided the doctor has prescribed to you that you no longer need this medication. Then, for instance, you take 5 mg for 1 week, 3.75 for the subsequent week, even for 2 weeks, then 2.5, then 1.25, and gradually completely taper off. This medication should never be abruptly discontinued, of course, under any circumstances. It's probably his peculiarity. Regarding the maximum dose, it is 20 mg per day. This dose is considered to be very large. To be completely honest, I must admit that we rarely use a dose of 20 mg, as it is very uncommon for us to do so. Because 10 mg is usually due to gas, even 5 mg. Be very careful. Under no circumstances should you, firstly, prescribe this medicine to yourself, and secondly, prescribe a medication with higher doses. We will not delve into the specifics of the mechanisms of action. The sole point I wish to convey is that the Concor medication decreases blood pressure and decelerates the heart rate. He alleviates, if you can phrase it like that, the burden on the heart, aids the heart to contract more accurately and forcefully, so to speak. But this is a simplified version. Generally, its main effects are reducing blood pressure and heart rate. Now let's talk about the cases when it is undesirable for a Concor to be taken after all. It's important to understand that Concor isn't a first-line drug. If you have initial manifestations of arterial hypertension, hypertensive disease, starting with beta blockers right away may not be advisable. Given the existence of inhibitors, there are particular strains that are more suitable for this, especially if you still have only been diagnosed with arterial hypertension. If you have, of course, other concomitant diseases, such as chronic heart failure and ischemic heart disease in the form of angina and tension, then it is really possible to prescribe Concor. It combines well with other drugs that are prescribed for pressure, like, for example, chronic heart failure or hypertension, to effectively manage the condition. It can be taken with ACE inhibitors, with angiotensin receptor blockers, with diuretics, and with calcium antagonists. This medication is highly versatile, and in reality, it can be safely combined with any of these primary categories of cardiological medications. Now let's go back to the cases when it is not advisable to appoint Concor after all. Firstly, it is not prescribed in emergency situations such as cardiogenic shock, which is a sudden drop in blood pressure, some second, third degree AV blocks, or sinus node weakness syndrome. That is, when your pulse is reduced, for example, below 40. In general, if your pulse is approximately 50, below 50, then the appointment of Concor is generally questionable, of course, because it will further lower your pulse rate. You will need to be very careful with this. Therefore, in emergency situations, it is usually not prescribed. But we are now talking about the planned indicator. It is clear that if an emergency situation arises, it is better not to take any action on your own, but to call an ambulance or seek help from qualified institutions. You should also be careful if you have bronchial asthma or chronic obstructive pulmonary disease. This is not an absolute contraindication, but you still need to be extremely careful because the competition can cause bronchospasm. Although, if you read the instructions, I repeat, there are contraindications. Most likely this will not happen, but severe forms, especially severe forms of bronchial asthma, and the so-called HOBLE, or chronic obstructive pulmonary disease, you need to be extremely careful because it can cause bronchospasm. Children who are under the age of 18 are also not recommended to take Concor. As for pregnant women, if you open the instructions, it also states that it is undesirable and only in the case of emergency indications. In fact, beta blockers can be taken during pregnancy, but Concor is not the preferred medication for pregnant women. You should prefer metoprolol, so if you are pregnant, it is better not to take Concor. To provide a summary, I would like to express that Concor is actually a highly effective drug. In principle, this group of beta blockers without Bisoprolol has proven its effectiveness, and as a result, it is included in clinical recommendations. Therefore, Concor is widely utilized and highly recommended in modern medical practice at the present time. We actively employ Concor due to its proven efficacy and widespread usage. The sole matter I desire to convey is that the medication is rather serious, and it should never be self-prescribed because it has a considerable number of side effects. And the medication can have different effects on each individual, so if there is still a need for taking it, it is necessary to begin with small dosages and gradually increase as needed. Here is a small video with informative content. Thank you for watching. Goodbye, and most importantly, stay healthy.